This is an infection which occurs typically in patients who've had valve operations some time after the operation, usually some weeks after the operation. Why this infection occurs in patients is not absolutely understood, but in general the infection starts in and around the time of the operation and then simply grumbles away until it eventually causes some symptoms. The January cut-off point is because that is when we think from our laboratory records, that's when we began to see an increased number of this particular organism causing this and other less serious infections. The other less serious infections are not a problem to most patients, and because in most patients who have this particular complication after this kind of surgery, you will get to that complication, the infection will become apparent within 2 or 3 or 4 months. Very rarely does this kind of infection become apparent for the first time after 6 months. Of those 28 patients who had operations which were very similar to the cases, we're confident that we have contacted all bar one of those patients. We're making strenuous efforts to do so. Of those 28 patients, 5 are being treated. They're making good progress, although one of the patients has just started treatment, so it's relatively early days to make a judgment about that patient. Of the patients who were at home and who we had to contact at home, all of those patients whom we've managed to contact, 14 patients are well. 2 patients have, as a precaution, been offered further tests. Indeed, one patient may be admitted tomorrow for some further tests.